Good afternoon, everybody. Welcome to another episode of Leaders and Friends. I'm super happy to have a good friend of mine, Ali Diab, on the Zoom today. Ali is the founder of Collective Health. He's kind of a classic, what I would say, Silicon Valley founder, Stanford soccer star. This is the second company he's founded. I've been on the Collective Health board since 2018. It's been super fun to be with Ali. He's a leader who I always enjoy people that lead with a point of view. In other words, they're able to absorb lots of stuff that's going on, but they add clarity to the noise, and that's one of the things that has kept Ali so successful. Collective Health is a kind of a high-tech benefits platform for self-insured employers. So he deals in the really complex healthcare world. So Ali, welcome. It's great to have you, and I look forward to a great conversation.
Thanks for having me, Jeff. It's great to see you as always.
Yeah, no, that's great. So Ali, maybe just start, for the audience, some of whom don't know Collective Health, just kind of like why you started the company, what you've done, and where you are today.
For sure. I think, like you said in your intro, thank you again for the very kind intro. Not sure I deserve it, but I've been in technology for most of my career after dropping out of a graduate school program to work on Wall Street. Actually, initially, I'm in the very late 99s, 2000s, decided to quit my job on Wall Street and start a company with some friends, and have been in the tech sector ever since. For me, starting Collective Health was very personal. I was hospitalized in early 2013, totally out of the blue with a small intestinal obstruction. It nearly killed me. I was in the hospital for 3 weeks. I had most of my small intestine removed in a series of very painful resections, surgeries. And, I was fortunate to be in the United States, fortunate to be close to a place like the Stanford Medical Center where I was treated and where my life was saved. And at the time, also thought I was fortunate to be on a big blue chip employer platinum PPO health plan. But about a month after coming home from the hospital, I started to receive denial of coverage letters from our insurance carrier. And that's sort of what precipitated my interest in health insurance. I'm not a healthcare guy by background, as you know, other than being the son and sibling of doctors. But it sort of was just shocking to me from a customer experience at a very superficial level, just how hard it was to get information out of our health insurance company as to why my hospital stay or most of it was denied, and then what to do about it. So, as just a very simplistic, naive, sort of consumer oriented tech person, I was like, well, this user experience could be a whole lot better. And that's really what sort of kicked things off. But it's very personal for me.
Yeah, no, that's awesome. So you've been at it now 10 years.
12 years.
Yeah, 12 years.
Yeah,
It's like any good founder, you've got to kind of pivot the company as the world changes. Talk about the pivots you've done and how you know kind of when to change and that to me is kind of like one of the two or three things most important that every founder has to really grapple with.
for sure. I mean, as you know, you've been on our board for a very long time. We actually haven't pivoted all that much. We've sort of refined our go-to-market. But, I tell people healthcare, and you know this better than anyone, healthcare is not for a tourist to come and start something. It requires a lot of understanding of regulation and how markets work and all the different economic drivers and incentives that underpin the US healthcare system. So thankfully, my co-founder actually has a PhD in economics. I don't, as you know, but I studied it for a long time. We spent a lot of time thinking about how to address the market and how to create, I don't like saying disruptor, but how to create a new entrant in the market that didn't exacerbate the existing economic perverse incentives that underpin it, which namely just drive inflation and price increases in the market. And so we were very deliberate in trying to build something that didn't incentivize us to increase the cost of care for anyone, our customers, for the government, for anyone. And so we decided to focus on enabling large self-insured American employers to basically procure healthcare more intelligently, more transparently using our platform, and then to instantiate that also through our platform into a health benefit plan that their people could understand very cogently and have a customer experience that was nothing like the one that I went through. And that's been largely what we've been doing, as you know, for the last
Mhm.
decade plus since we went live with our first customers. Now, as you know, we've hit some headwinds, stubbed our toe a bunch, going to market and with some macro, let's call them abnormalities that have emerged. The pandemic, I think, is probably the best one,
Mhm.
where replacing your health benefit plan with a new entrant like us was not top of mind for people. And so we did, to your question, I wouldn't say pivot, but we kind of hived off a small part of the organization to explore other things to do. For example, like enable employers to bring people back safely into the office who needed to do that during the pandemic. But as the pandemic receded, we found ourselves kind of going back to our core business. And so I think the point I think that you're bringing up, which is really important, is, and I say this all the time internally, the best organizations are the ones that learn and assimilate that learning and adapt to that learning the fastest.
Mhm.
Not necessarily the companies that have the smartest people or that have the best tech or anything. It's just those companies. I think Jim Collins sort of talks about this a little bit in Good to Great. You really just need to be truthful with yourself, and you need to be able to look at that truth when it's really something you don't want to look at, and then you
Mhm.
need to be able to assimilate and internalize what you're learning from it.
When you look back over the 12 years, like what's the one thing that you really got right? And then what's the one thing you look back and say, gosh, I wish we hadn't done it this way.
It's funny. I mean, hindsight is 2020, as you know. I think you gave me some very good advice when you first invested in the company and joined our board. I think you said, don't use venture capital dollars for non-venture capital things. And I think what you meant by that is there were all these health insurance tech and managed care startups that were emerging that were blowing through very, very expensive equity to underwrite healthcare risk.
Mhm.
And I think that's probably one thing we've gotten really right, which is it's been tempting because there's just so much more revenue available if you just take control and manage the entire bolus of healthcare spending for a customer and just say, you know what, I'm going to offer you a fully insured plan or a fully insured Medicare plan or even an accountable care type of plan where I just take on the entire responsibility of that risk, manage all the physicians, manage all of the users on that healthcare, and then I can book that revenue. But as we all know, especially with medical loss ratios and stuff like that, most of that revenue is accounts payable anyway. It comes in the door and it goes out the back, almost instantaneously. And then it also creates, in addition to being risky, it also creates, again, I think, a perverse incentive to actually want to increase the cost of care because that's how you make a greater margin on
Mhm.
that underlying revenue. So we, I think, made a really, I think, prescient decision not to do that. It was hard because, as you know, we have been revenue starved as an organization, especially compared to the incumbents that we compete against who make money in all sorts of ways. But I think that's actually been to our advantage because it's forced us to be efficient and it's forced us to stay focused on the things that matter. And now, 10 plus years on, with like the Medicare market cratering, we're actually in a very good position because those easy dollars aren't there anymore. The
Right.
government isn't paying the way that they used to. It's pulling the plug on a lot of programs because it can't afford to pay for them. None of us can afford to pay for them. So it's been actually, I think, a prescient decision.
Yeah, yeah. You and I have had this discussion a number of times. One of my theories about one of the challenges of healthcare is that the incremental buyer, by this I mean employers, right? The scale-based buyer doesn't do a very good job for
No.
some reason. And I sit there and say, like as an employer, if we had bought steel or components or precision castings, the same way we bought healthcare, gee, would have been bankrupt, right? So
Oh, yeah.
do you see that changing at all? And why do you think that is? And to a certain extent, that's kind of, I mean, you built a great big and growing company. That's kind of your sweet spot, and it's just continues to be a challenge. What do you think that is?
I mean, you and I talk about this all the time. Healthcare is the second biggest operating expense for any US corporation. It's insane. And so I tell people, like, and you've been saying this for a long time too, like, if you're in business, you're in the healthcare business, like it or not. Like that's just the way it is.
Mm,
It's an artifact of history. Again, no judgment about it. That's just the reality of it. I think the challenge with that is that, as you know, as well as anyone, the mechanisms to evaluate and ascertain whether what you're buying is indeed worth what you're paying in healthcare are much, much, much harder to discern than in any other market. I tell
mm,
people, as an economist, I've looked at markets for a long time, whether they're currency markets, stock markets, any kind of market, and then working obviously in ad tech and in sort of advertising driven consumer tech. I spent all day long thinking about how do you construct a market where there's liquidity and there's price transparency and there's clear signal and information exchange between buyers and sellers and vice versa. That does not exist in healthcare, unfortunately. And I think it doesn't exist largely because over time, these very large intermediaries, these large health insurance companies that really just sit in the middle between the people who provide care and the people who ultimately pay for care. I don't like how insurance companies call themselves payers. I think that's gratuitous. That's not true. You're not a payer, you're a middleman.
mhm,
They've entrenched themselves in such a way, kind of like, when I was at Goldman Sachs, we made money on information asymmetry, but there was a bid-ask spread that everyone knew on a security. You could just look it up. There's no
mhm,
bid-ask spread that you can look up on anything in healthcare in the US, with the exception of Medicare, Medicaid, where the government just says this is the price. It's
mm,
public. Take it or leave it. And so to me, the fact that there just isn't any even price signaling in healthcare makes it so hard for anyone, even like the most well-intentioned, to try to figure out how the heck do I understand and get at what I should be paying for this stuff. It's
mhm,
intentionally obfuscated. So we have attempted, as you know, to undo that because we don't have a dog in the hunt. At the end of the day, our job is to serve the large employers that we serve as faithfully as we can. And it's our job to give them as much information as we can in terms of, hey, this is why these things cost what they do. We recommend you actually shift your spending away from this to that because this doesn't seem to be driving an ROI for you. That's our whole modus operandi. But I think that's the primary reason why it's been really hard because you've been a CEO of a Fortune 10 company, Fortune 5 company. American executives aren't stupid. They're the best executives in the world. But like when you handcuff them and put a blindfold on them, it's like, well, yeah, it's like run down the street. How? Where? I'm gonna like fall and smack my face. So that's the problem.
maybe just elevate one more notch. Like I've been around healthcare now 25 years, and there's great companies in healthcare like Lilly and stuff like that.
There are.
But I've never seen the system in as bad a shape as it is right now. Inflation is screaming. The classic, I would say techniques to improve cost and quality just haven't worked. Consolidation, technology, all those things just haven't worked, right? So
Totally.
as we're sitting here in 2025, like how should we think about the US healthcare system and what might be possible in the next 5 years or 10 years or whenever? Because it's just I'm really depressed by where we are.
Yeah, I mean, this is where I do think government has some role to play. I am very much a small government person by background.
Mhm.
But I do think that, I'm sorry for the background noise. I do think that the health insurance industry and its power as an intermediary has done all of us a disservice. And they are also significant lobbyists, as you know. They spend a lot of money to keep people out of their business. I think the government could do a few small things, though, in my opinion, that could really help unlock and make this black box a lot more of a white box for all of us. And I've actually had these conversations with some people within the Health and Human Services Department recently. I think something as simple as requiring the real cash price to be something that everyone can access at the point of care is a really
Mhm.
small way of driving that price signaling that I was talking about. It's pretty insane to me that if I walk into a clinic in the US or a hospital in the US and I have a US health insurance card, I cannot ask what the cash price is. I will not be told what the
Mhm.
cash price is because it's under gag order. The insurance companies require the health systems that they contract with to not publish or disclose that information. That should tell you something. If you're hiding something, that should tell you something, or wanting to conceal something, that should tell you something. So I think things as small as that, and obviously on the pharmaceutical side of things, that's also rampant through spread pricing and all of the rebate, shenanigans that people have talked enough about. I won't cover that. But those small things to me are things that I think the government could regulate and
Mhm.
could enforce that are actually, in my opinion, very free market, small government kind of things.
Mhm.
And to their credit, I think the Trump administration in the first term tried to do some of these things, but the enforcement was lacking.
Mhm.
And then I think in the second term, we're seeing a little bit more of a step in that direction, but I still think there's not enough teeth to force I mean, the penalties on not doing this stuff, whether it's like publishing, your price schedules in machine readable format or whatever, there's no teeth. It's like $1,000 a day penalty. Like, well, that's a rounding error if you're United Health Group or if you're even a large hospital system. So I just think that to me is probably the most achievable, but yet I think very meaningful type of change that we can expect. It's going to take decades to kind of undo this intermediary dominated market.
Yeah.
But I tell people, and you and I talk about this a lot, that imagine if Stripe or Visa captured 30% of the operating profit contribution margin of retail in the United States. That's
Mhm.
kind of how the health care market works. These big intermediaries capture a huge amount of rent for not doing a whole lot. They contract, and those contracts, frankly, to me, it's hard to tell whether they're even good in many cases because there's perverse incentives to keep prices high, whether it's on the drug or on the service side of things. And then they ostensibly, process claims, manage plans and provide customer service. But as we've seen, they don't do that very well.
Yeah.
So like, why are they capturing so much of the pie?
And in the macro, again, if you look at inflation is more than 10% now, there's
Yeah,
fewer uninsured, or there's more uninsured,
yeah.
it's just,
Healthcare is 19-20% of GDP. I mean,
it,
I
it just ain't working.
no, and the Robert
Yeah.
Wood, Johnson Foundation publishes data on this. Last point on it. Like I think sometimes have a misconception of the US that we use more healthcare than other people. That's not true. We use
Yeah.
the same amount of healthcare as the Brits, the Germans, the French, the Japanese, whatever. But everything in the US costs 2.5 to 3 times as much at a
Yeah.
unit cost level.
Yeah. Um, Artificial intelligence, Sully, you're uniquely positioned, having been a successful tech founder, now a successful healthcare founder. Is AI a great tool? Is it the answer? Is it overhyped? How do you see the future of artificial intelligence?
I mean, so there's AI and then there's generative AI of the kind of transformer-based large language models that everyone
Yeah.
seems to be gaga about, which, there's a magic to, no question. When you use ChatGPT for the first time, you're like, oh my God, this thing could write like a high school or college essay for me in 5 minutes. Um, I think what we're seeing with AI, in my opinion, and this is maybe not a very popular opinion, is just really the evolution when you apply a huge amount of compute to machine learning systems. These are trained systems. They're large scale pattern matching and prediction systems, not unlike a lot of the simulation systems that I worked on. There's a Monte Carlo-ish simulation of sorts happening under the hood that sort of generates, that's why they're called generative, the next token or the next best thing to present to you. Um, I don't think we're anywhere close to systems that really replicate or replace the ingenuity of the human mind. So I think that's where I do think the technology is overhyped. But I do think the technology is very powerful when applied in certain cases. However, what I will tell you, because we're obviously experimenting with it extensively and deploying it at Collective Health, the classic input output or garbage in, garbage out problem exists with these systems as it does with any other. Maybe even exacerbated further by the fact that these systems, because of their probabilistic nature, can hallucinate or generate false output. So it's
Mhm.
almost a bit of a double whammy that you have to really control against. And in healthcare, as you know, we can't have any false positives. Like you can't tell somebody your benefits are this and they're why, or
Right.
you should go get this treatment. It's actually the wrong treatment. Like that's your DOA if you do that.
Yeah.
Consumer
Yeah.
setting, that's okay. So to answer your question, I do think some aspects of it are undoubtedly hyped, and they're obviously hyped by the people who are trying to build their companies around this. I do worry about the snapback on it. There's a lot of data, as you know, there's a New York Times article published last week that shows, to date at least, and I think you know I'm on the board of the Stanford Institute for Economic Policy Research, and we have a bunch of researchers like Eric Brynjolfsson and Nick Bloom and others who spend a lot of time thinking about how does AI improve productivity. We're not seeing the massive boost in productivity. That's not to say it's not going to come, but I think it's going to take a while to adapt our systems, to adapt our data, make it sort of available for these systems to ingest and to be trained on, and then our workflows to really drive the kind of productivity that we want. I think, yes, you'll find specific use cases where you're like wowed, but it feels to me more like a party trick a little bit than an actual like sustainable market or industry.
And I think to your point, it's so use case specific, like, and
Yes.
unless you can re-engineer a process, it's not going to be that, kind of disruptive. And so if you're in a contact center or call center,
Yeah,
it's going to be highly,
absolutely.
right? If
Absolutely.
you're in the media, if you're making commercials for TV, you better go find another job, right? Because AI is going to be,
Totally.
but look, if you're a dermatologist, doesn't matter all that much, I don't think. I just think it's, we tend to be too much pendulum one side or the other versus like picking our way through what it's really going to mean.
Agree. And I think even in those settings, it's going to be an assister
Yeah,
than a replacer. Like look at like my kids, I've used, teenage kids, they'll use ChatGPT to give them ideas or create an outline for something, but then they still have to go and refine it and
yeah,
build on it, especially, because they'll get in trouble if they don't. But even in a code generation setting, like we use a lot of these Copilot tools,
right.
like, man, you better know how to code to be able to evaluate the output of these code generation systems because you spend all your time debugging.
Yeah.
And so
Yeah.
in some ways, there's almost like a transference of workload and a transference of skill type versus a replacement entirely of the skill type. You're more of an editor rather than a writer.
Ali, you've been, lived the life of an entrepreneur. Some of the people that tune in on Leaders and Friends are starting their companies, things like that. What's the one piece of advice you give to everybody that wants to start up a company?
I'd say the most important piece of advice I could give anyone is get some investors and some people around that board table of yours to keep you honest and to prevent you from believing your own BS. I think there's a I think there's a folklore a little bit in the valley that, you know, amazing entrepreneur founders need to have like 100x control versus their investors, and they need to be basically told by no one what they should or shouldn't do. And I actually think that's wrong. I actually think having people tell me that my shit stinks, pardon my French, has actually been one of the best things that I've had because I think it's prevented me and the company from making some pretty
Mm,
dubious decisions.
yeah. No, I think, a big company or small company, to get something to change, you have to be uh, blind almost. You have to be so focused on something. You have to be, just like overcommitted, which,
Totally.
which you need some people who are whispering to you, you're
Yeah,
wrong.
totally.
You better, and so it's that blend of two different styles that actually makes,
Right.
one of the things I talk about Jack Welch, one of the things that made Jack effective is that he was completely irrational a lot of the
Yeah.
time.
Mhm.
But he would circle back and say, "Hey, I was listening. I was actually listening to you. I just
Right.
had to pretend not to." So
Right.
it's good advice. Last question, Ali. What's made you such a good leader? Like what is in your DNA that has helped you, you know, stay persistent, dedicated? It's not all roses when you're starting a company, yet you never have, I've never seen you, lose any of your passion and commitment and all that. So what makes somebody that committed?
I mean, I think you kind of alluded to it. I think a lot of leadership and whether or not you're good or bad at it is context specific. So I
Yeah.
don't know that I'd be a great leader in another context. I think I'm a good leader in this context because it's very personal for me and I have a deep-seated interest to see change occur. I think generally speaking, I mean, you can evaluate this better than anyone. I think that by and large, I like people. I've played team sports a lot of my life, had to deal with all sorts of both very talented but also idiosyncratic personalities as a result of that. Um, and I think actually in some ways being this, the child of immigrants, maybe kind of more sensitive to kind of difference and sensitive to kind of being an outsider or sensitive to like maybe people drowning you out just because you like weren't sort of prototypically what people expected in that role. And so I think that's maybe a little bit more sensitive, a little bit more observant of difference, which I think is helpful as a user. To your point, when you opened up the episode today, I think good leaders, I think you're a great example of this, are good integrators. They can sit back, take it all in, including some very unpopular perspectives, even vis-a-vis their own, and say, you know what, I'm going to hold my tongue for a second and hear this person out, and then kind of integrate it all, and then clear through that diverse noise to come up with a signal. And I think I'm pretty good at that.
Yeah, that's great, Ali. Well, this has been a great conversation. Ali, thanks so much.
Thank you, Jeff.
Continued good luck with Collective Health. I'm right there with you as a
Thank you.
partner.
Thank
And
you.
thanks for sharing so many great views on a startup and this incredibly wacky world of healthcare.
For sure.
Thanks, Ali, and we'll see everybody next episode.